Ticarcillin, complete drug information. 1. Generic name, drug class, brand name. Generic name, Ticarcillin. Drug class, extended spectrum, antipseudomonal beta-lactam antibiotic, penicillin derivative. Brand names, Ticar, discontinued in many regions. Timentin, combination of ticarcillin's clavulanic acid. 2. Definition: ticarcillin is a semi-synthetic penicillin antibiotic that belongs to the carboxypenicillin group. It has an extended spectrum of activity, particularly effective against gram-negative organisms, including Pseudomonas aeruginosa. Because it is susceptible to beta-lactamase degradation, it is often combined with clavulanic acid, a beta-lactamase inhibitor, to enhance its activity. Mechanism of action: ticarcillin is a beta-lactam antibiotic that inhibits bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, located inside the bacterial cell wall. This prevents the final transpeptidation step in peptidoglycan synthesis. Without cross-linking, the bacterial cell wall becomes unstable, cell lysis and death, bactericidal effect. It is time-dependent killing. Efficacy depends on duration. Concentration stays above MIC. Inactivated by beta-lactamases unless combined with clavulanate. 4. Uses: treatment of serious bacterial infections caused by susceptible organisms, especially gram-negative rods, often reserved for hospitalized patients with complicated or resistant infections. 5. Indications: respiratory tract infections, pneumonia, hospital-acquired infections, aspiration pneumonia, urinary tract infections, complicated resistant organisms, intra-abdominal infections, peritonitis, intra-abdominal abscess, skin and soft tissue infections, diabetic foot, cellulitis, gynecological infections, endometritis, pelvic abscess, septicemia, bloodstream infections caused by susceptible gram-negative organisms, bone and joint infections, osteomyelitis, septic arthritis, Pseudomonas aeruginosa infections in immunocompromised patients. 6. Contraindications: known hypersensitivity to ticarcillin, other penicillins, or beta-lactam antibiotics, e.g. cephalosporins, carbapenems. History of anaphylaxis or severe allergic reactions to penicillin. Caution in patients with heart failure, renal impairment, or hypertension due to high sodium content. Before taking this medicine, precautions: inform healthcare provider if you have allergies, asthma, risk of cross-sensitivity, kidney disease, requires dose adjustment, electrolyte imbalance, risk of sodium overload, gastrointestinal disease, particularly colitis, increased risk of C. difficile infection, bleeding disorders, or platelet dysfunction. Pregnancy, Category B, no evidence of harm in animals, but use with caution. Breastfeeding, excreted in breast milk in low concentrations. 8. How to use: administered only parenterally, intravenous IV, preferred route, intramuscular IM, less common, not effective orally, acid labile, destroyed in stomach. Given in a hospital clinical setting by healthcare professionals. Dosing information: adults, IV-IM, 3 gram every 4 to 6 hours. Severe infections, up to 3 grams every 4 hours. Maximum daily dose, 24 grams per day. Children, weight-based dosing, typically 200-300 milligrams per kilogram per day in divided doses. Renal impairment, dose must be reduced depending on creatinine clearance. Example, CRCL 10 mL per min, extend dosing interval. NAP 10, missed dose and overdose. Missed dose, rare in hospital setting. If at home therapy, take as soon as remembered unless close to next dose. Never double dose. Overdose, symptoms: seizures, neuromuscular irritability, confusion, renal dysfunction, electrolyte imbalance, hypernatremia. Treatment: supportive care, IV fluids, seizure control, hemodialysis may help remove drug. 11. Stop or avoid taking. Stop immediately and seek medical help if severe allergic reaction, rash, itching, swelling, anaphylaxis, severe diarrhea, risk of Clostridioides difficile colitis, unusual bleeding, bruising, platelet dysfunction, severe renal dysfunction develops. 12. Side effects common: local injection site pain, redness, phlebitis, GI, nausea, vomiting, diarrhea, skin rash, itching. Serious hypersensitivity reactions: urticaria, anaphylaxis, Clostridioides difficile associated diarrhea, CD-AD. Electrolyte imbalance, hypernatremia, hypokalemia, seizures, SB in high doses or renal failure. Hematologic effects: neutropenia, anemia, thrombocytopenia, prolonged bleeding time, hepatotoxicity, elevated liver enzymes. 13. Vital information. Ticarcillin contains significant sodium up to 5.2 mg per gram. important in heart failure, renal disease, hypertension. Only treats bacterial infections, not viral. High risk of superinfections with long-term use. Should be used only when culture sensitivity suggests susceptibility. Number 14. Other drugs that will affect ticarcillin. Probenecid increases ticarcillin blood levels, reduces renal clearance. Aminoglycosides, synergistic effect but inactivated if mixed in same IV line, must be given separately. Anticoagulants, antiplatelets, e.g. heparin, warfarin, aspirin, increased bleeding risk. Nephrotoxic drugs, e.g. aminoglycosides, vancomycin, cyclosporin, amphotericin B, additive kidney damage. Methotrexate, reduced clearance, increased toxicity risk. Oral contraceptives may reduce effectiveness due to gut flora alteration. This is the complete detailed drug information for ticarcillin. Thank you. Have a nice day.